I would thank opportunity. I'm Dr. Srinivas Abhishek, consultant pediatrician and neonatologist from Hyderabad. I work in Suraksha Women and Children Hospital in Hyderabad and the Srinidhi Children Clinic, Secunderabad. I have experience of 12 years. So today, I think I'm joined by the young parents, the mothers and fathers of the babies who are much concerned. The topic is about the post-vaccination care. So this is a very important topic. Vaccination has been a very important thing always, and post-pandemic, post-COVID, the importance of vaccination and all these things is has much relevance with the parents as well as the doctor. So regarding the vaccination, vaccines protect against around 15 to 20 life-threatening diseases, be it tuberculosis, diphtheria, pertussis, hepatitis, chickenpox, and all these things. But what the statistics says, you'll be surprised. 10% of the parents, they tend to skip on the vaccines with the fear of a needle. That is one of the things what the statistics says. So what I at this point want to say is it's about the right of the child to get vaccinated, and it's the duty of the parents to vaccinate their child. And it protects against not just the life-threatening diseases, be it rubella or tuberculosis and pneumococcal diseases, but some morbidities also, something like a chicken pox. Once a child grows up, and the child should not ask us like why he or she is not protected from chicken pox, where vaccine is available to protect against it, where the kind of patches or the cosmetic difference it can make. So about the post vaccination care, like most vaccines, they pass through stringent norms. They pass through phase 2, phase 3, phase 4 trials, and after clearance from the government of India only, the vaccines are released. So all vaccines are very, very safe, except for few mild transient reactions, which usually tend to wean off in 24 to 48 hours. And so here what the parents should be more aware is about the harmful effects, what are the adverse effects. So to frankly tell, the adverse effects are almost nil. But yeah, like any medicine or anything, they do have it. Probably a 1 in 10 million can cause some adverse effects. So it's about like what are mild reactions, and what has to be reported to the pediatrician. It's most important. So immediately after the vaccination, the parents are always suggested by the pediatrician to always wait at his or her clinic or hospital for at least 15 minutes for any kind of reactions or any concerns the parent or the child might be having. And adolescents, they sometimes can go through some syncope or something out of the stress or tension. And the babies, they tend to cry a lot. So the routine thing, something like swaddling or cuddling and skin to skin contact is very important. And if it's not a oral vaccine that was given, the mothers should be suggested to breastfeed their baby who was less than 6 months, especially. And the other things, these are small things but very important. When the child is probably 5 years or plus, the child should not be reprimanded, like the child is not brave or something, that they should not be scolded or something, but rather they should be appreciated. And if the child is crying, they have to be supported, that nothing to worry, and a skin to skin contact and hugs are very important. And coming to the mild reactions, yeah, there can be some mild discomfort for 24 to 48 hours. And probably if there is some swelling or some redness or something, you can just put a cold and clean cloth on the area. So I can see some questions coming up. Let me see. So one of them asked what to do after the baby has vaccines. So immediately after the vaccines, as I told you, if the child is less than 6 months, feeding would be ideal, and should see for any mild reactions. Local reactions and systemic reactions will be there. These are very mild and transient, which are something like redness, swelling, where a normal cold cloth can be applied. And if there's some fever or something, paracetamol drops or syrup can be given according to the dose, each according to the age group, according to the weight. The pediatrician would suggest to give paracetamol drops, and in very few cases, ibuprofen drops can be given for 24 to 48 hours. And hydration has to be maintained for the child. Give plenty of fluids, and rest is one thing which is very important. So another question I see is, can I bathe the baby after vaccination? Yeah, a lot of parents, they keep asking me that whether they can bathe. Yeah, you can go with the routine schedule, the normal schedule. You can give a bath and massage as usual immediately the next day after the vaccination. There's no contraindication or there's no restriction per se. How long does it take for the babies to recover from the vaccines? Yeah, this is an interesting question. Like the mild discomfort and redness, swelling, and the fever, and with the loss of appetite, and all these things usually last for around 24 to 48 hours. And definitely, if it is more than 48 hours, that has to be reported to the pediatrician. And this what I told is about the 15-minute waiting at the hospital is always better to be on a safer side. Other question would be, should I let my baby sleep after vaccination? Yes, you can very well allow your child to sleep. That actually gives the baby some kind of energy and all these things. But one thing is, one has to always observe for the danger signs, whether the child is too dull or not taking feeds or things like that, which is very important, like not getting up from the sleep. That is a dull activity is what I am saying. That is very important, just to monitor it. Otherwise, yeah, rest and sleep are very important. You can allow the baby to sleep. What if the area which is vaccinated gets some rashes or something? So there's nothing much to do. You should not rub, or you should not scratch or apply any kind of ointments and all these things. You can just apply a wet, cool, clean cloth or a ice pack to the area. And if there is some swelling or something, you can give paracetamol drops, and in some cases probably can give ibuprofen drops. And if there is some itching or something, yeah, antihistamine or antipruritic drops can be started for the baby. One of the mothers asked, is having fever after vaccination for the kids, is it normal, and what a parent needs to do? Yeah, having fever is normal, and at the same point, there are now lots of vaccines that are available which are painless, which don't cause fever. So if the parents are affordable or they want to take it, yeah, they are as effective as the vaccines which cause pain. So now painless vaccines are available in the market, and they can be taken. And there are also combination vaccines where there are a lesser number of shots. With a single prick, with a single shot, you can protect against as many as 7 diseases, to be specific, to prevent it. And so fever means that the antibodies are being produced by the child, and that the body is getting ready to act against any further infections, and they have all the tools and armory to fight the disease out. So getting a fever is that's normal, but the fever should not rise beyond 102, and anything high grade fever of 103 not coming down in 48 hours has to be reported to the health personnel. And baby keeps sleeping after the vaccination, is it normal? Yeah, that's normal. Probably a lot of parents or the attenders, they tend to connect everything to the vaccine, but it's not so. So sleeping more and vaccination has no link. So it's absolutely normal for the child to sleep. The only thing, any activity is dull or something, has to be checked on. And so let me take the last question. When I need to call the doctor if the vaccination does not suit my baby? So we have to differentiate between what is the mild form of reactions and what are severe forms, that is adverse effects. So adverse effects, as I told you, they are seen in 1 in a million or 1 in 2 million. And the adverse effects that have to be checked on is high grade fever of more than 102, 103 beyond 48 hours has to be reported. Any kind of convulsions, dull activity has to be reported. Any gastrointestinal symptoms, something like a vomiting, diarrhea, has to be reported. Any kind of hoarseness of voice and breathing difficulty, shortness of breath, and stridor, wheezing, the respiratory symptoms have to be reported. Any kind of tachycardia, that is the heart rate going up, palpitations, and falling of the blood pressure has to be reported. And any kind of facial puffiness and thickening of the throat and a feeling of discomfort at the throat and or continuous cry of more than 3 hours of the child has to be reported. These would be the adverse effects that have to be reported for appropriate care by the health personnel or the pediatrician. So this would be about the vaccinations and post-vaccination care. So my takeaway message would be that there are lots of diseases, and among them, many diseases are vaccine preventable diseases, and some of them prevent from mortality, that is death, prevent from carcinomas, cancers, and prevent from morbidity and cosmetic issues also. And it is just not the duty of the parent, but also right of the child to get vaccinated. And the symptoms or reactions are very mild, transient. Vaccines are much proven, have gone through stringent norms and available in the market. So they have to be taken, and the symptoms or anything would come down in 48 hours. And any concerns or adverse effects beyond 48 hours, or as I have mentioned, have to be reported to the health personnel for any appropriate action. That would be one thing. So signing you off, you can follow me on Baby Chakra by using my referral code, Dr. Abhis, DRABHIS. That is the code. I think you can get even some discounts on the whole range of the organic products also. And catch you again. Take care, be safe, and be healthy.